Hello and welcome to rePRO Film Festival by mama.film. I am Debbie Samples.
I'm Leela Meadow-Connor.
And I'm Mallory Martin.
As the founders of rePRO, we want to thank the village of people who have made this festival possible, our filmmakers, special guests, partners, sponsors, and of course, our audience. You have lent your time, talents, and expertise to help amplify the voices that are so crucial in the fight for reproductive justice and bodily autonomy.
When you purchase tickets and donate to rePRO, you've become an active participant of change, as all net ticket sales and accompanying donations support our 5 beneficiary organizations.
We thank you for participating in these vitally important call to action conversations and hope you leave feeling empowered to be your own advocate in the world. Please keep women's reproductive rights at the forefront of your mind as we enter this critical election season.
We're pleased to present the Abortion Care Critical Crossroads Call to Action Conversation, moderated by Toni Leonard, a founding mother of reproductive justice.
Greetings and welcome to rePRO Film Festival's Abortion Care Critical Crossroads Call to Action Conversation. A conversation that aims to counter the stigma against abortion care providers by bringing to light the critical crossroads they face during their daily work at women's clinics. My name is Dr. Toni Bond. I am one of the founding mothers of the reproductive justice movement, a religious scholar, and the board chair of Interfaith Voices for Reproductive Justice. And tonight I will be your moderator for this conversation. I am joined by an incredible group of individuals. First is the director and producer of the documentary Our Bodies, Our Doctors, Jan Haaken, and Julie Burkhardt, the founder and CEO of Trust Women, and Dr. Gillian Schivone, an MD, MS, a fellow of the American Congress of Obstetricians and Gynecologists, and assistant professor of obstetrics and gynecology at the Washington University School of Medicine. To those of you watching and listening in, feel free to ask questions along the way using the Q&A portal, and we'll do our best to answer as many as we can by the end of the conversation. So let's get started. I watched the film and there were so many just poignant and profound moments in the film. I mean, even down to the way it opened, hearing from attorney Sarah Weddington and her arguments around the case of Roe v. Wade. And I just think overall, throughout the film, what was done so very well. I think, for many people, they don't get a chance to see the lives of the providers. They don't get a chance to kind of see inside their work. And this film really gave you that kind of humanity side of providers. One of the providers talked about oftentimes physicians who provide abortion care are labeled as abortionists. And I think what came through loud and clear in this film was that they're not abortionists, but they're physicians who provide abortion care. And that really, I think, spoke to, that really, I think, just gave this great sense of humanity for the providers. I'd like to start with you, Jan, and just kind of, I know that was your intention, but I mean, what was your process in just kind of thinking about how you would add this, how you would show this humanity side of the providers and also the care that they provide to their patients, because that came across too.
Well, thank you for that introduction. And I want to just say a little bit about how this began. It began when I was brought into a team at the University of Michigan, Ann Arbor, to do a short film for them based on their research around the world on the experiences of abortion providers and how they dealt with stigma in their own profession as well as in their communities. And I did a short film for them called Being There, about the theme of how the community and healthcare professionals depend on abortion providers being there. But in the course of making that short film, I felt there was a much larger and fascinating story to be told about people who do this work. Now, there are many good films about the barriers women face in accessing abortion, but very little on what it's like to get up every day and go into a clinic and do this work. And so I reached out to more providers in taking on this idea of a feature film. And we wanted to pull back the curtain on what still remains, even in the pro-choice movement, kind of mystified and hidden area of healthcare. And to also take up the complexity of abortion. I think in the pro-choice movement, there's been a reliance still on very simple stories and placards and kind of simplified appeals to people without taking on more of the complexity of this issue around things like later term terminations and how providers themselves think about this work from their point of view. So, and I felt like there was a lot to be learned from providers, not only about abortion, but about the broader healthcare system, about reproductive justice. We wanted to recognize the contributions of Black feminist thought to expanding beyond pro-choice to thinking about reproductive justice, and to tell a more complex story and to dispel some of the myths that survive because it's still hidden behind a curtain in the culture, including in film culture.
Julie, give your thoughts about how the film was able to give the viewer this sense of what it means to run a clinic in the midst of having, the stigma attached to it, having protesters outside the clinic every day. I thought that the scene where you had the one woman outside protesting the clinic with the sign, right? And that she was offered the opportunity to come into the clinic and see what a day in the clinic was like, and clearly didn't take advantage of that. But talk a little bit about your reaction to some of those parts of the film.
Yeah, that's a great point that you make, and that in the film that was apparent. I can't tell you. We have protesters at our clinics day in and day out. It's an 8 to 5 job for folks, and we've had open houses where we have invited people from the community to come into the clinics. And I always think it's a little odd that folks who stand opposed to us in our communities also then refuse to come into the clinics. And I wish that at one point that people would take us up on that, because I would love to show people our procedure rooms, our recovery rooms, our exam rooms, where the nursing staff sits, and that, we are a bona fide medical clinic that provides abortion care.
Have you ever had anyone to take you up on the offer to come and take a tour of the clinic? Take a tour of one of the clinics?
It seems like it's always been, I love the choir, but it's always been people from the choir. So it's our elected officials who care about equitable policies, people from the community, maybe other leaders in the community who, care about women's and people's reproductive health care. But unfortunately, it's never been those who so vocally stand opposed to abortion and reproductive rights, health, and justice.
The film also showed quite a bit around protesters who were tied to the religious community. Have you had support from progressive religious leaders in the communities where your clinics are located?
Yes, we have and we do. We have support from one of our local synagogues, the Unitarian Church, more progressive mainline Christian churches. So we do have some clergy who clearly have stepped forward. And that is a place where it would be wonderful to see more robust support that I feel has faded since the 90s, maybe. But we do have some support in those areas.
Mm-hmm.
Toni, can I add a bit about how we thought as a team about religious influence over abortion care? I think there's a kind of smugness in the Northwest. I live in Oregon, and many of the providers are from Oregon and Washington, and there's a tendency, I think, in general, to lay a lot of the problems in the country on the South, the conservative South and its backwardness. But actually about half of the beds in Washington, and close to that many in hospital beds in Washington, and about a third in Oregon, are under the control of the Catholic bishops. And when women need to have a procedure in a hospital, they don't have access there. And many people are not aware of the role of Catholic hospital mergers, how profound an influence this is on healthcare plans, on hospitals that deny even women who are coming in for an ectopic pregnancy. Some women have died or in very serious health situations because of that lack of access. So I think for many people are familiar with kind of the crazy preachers on the streets protesting this, but not as aware of these people in suits governing Catholic hospitals and institutions that also restrict access. So that was for me an important theme to draw out in the documentary.
Absolutely, and I appreciated how you all referenced the protocols from the U.S. Conference of Catholic Bishops, and kind of showed the document that most all of those hospitals are required to abide by. I'm glad you brought that up, Jan, because a lot of these hospitals are located in communities of color that also have other extenuating general health conditions. And so it really does place women who are in need of reproductive health services in really a healthcare bind, because those are the same institutions that they go to for care around diabetes and high blood pressure and heart disease. And many of those places are able to provide fairly decent care to folks in the community, except when it comes to needing reproductive health services like abortion care, contraception, if they have an ectopic pregnancy, if they have a miscarriage. So you're absolutely right. Dr. Gillian, I would like to bring you into this conversation and just kind of get your reaction, thoughts about how the film, really talked about the stigma that providers of abortion care experience, and how they were able to really, as I said, show the kind of human side of providers and what it means for you all to get up every day and go and provide this very necessary reproductive health care to people.
Yeah, I loved the film, and I felt myself nodding along to a lot of the things I was seeing, especially because I work in even one of the spaces that was shown in the film. But a lot of the experiences that people relayed were familiar to me. I would say that in general, I don't feel as much stigma in my work situation. But what's really heartbreaking is when patients have absorbed that stigma. And so they are very afraid that you are like some sort of failed doctor that couldn't do anything else, or that you don't know how to do anything else. I had a patient that I was discussing her tattoo with her because she had a C-section and it would have interrupted the tattoo. And she said, "Oh, you do those too?" And I said, "Yes, I'm an OBGYN." And it's really very sad when patients are so scared to get care because they think that we're doctors that are not up to standard.
Sure. There was another point in the film, Jan, where it highlighted the 72-hour consent statement and 72-hour waiting period in Oklahoma. And, I knew of it, of course. And so it's almost like you can intellectualize it, but it was something very different to actually see the staff person reading this very long document to this woman over the phone. And then to hear that, and again, you can intellectualize it, but I think the way it was portrayed in the film, it made it so very real, and that after the woman heard that was read the statement, she still had to wait, right? And so you really, it really did a good job of, showing what that meant, that every amount of time counts, not only because someone could transition to the next trimester, but also because it might increase the cost. And we know that so many people are unable to afford the cost of an abortion, and that time is of the essence. And I really appreciate how that segment right there really, I think, gave life to what that really meant.
Yep. Audiences often laugh during that segment when Katie is reading in a rapid fire style, the complying with the law, because I wanted to also show how people who do this work are both have to comply and also can subtly resist these irrational laws. So there was some of that conveyed there, that she complied with the law, but it was delivered in a way that, they're not required by law to read it at a particular speed. And she and the person on the line understood that it was sort of a ritual she had to go through. I don't know if Julie, you want to comment on that, but audiences often laugh during that scene.
Yes, right. So we have to read that over the phone in order to be in compliance with Oklahoma law. But exactly what you were saying, Toni, it's pushed people from a medication abortion to a surgical abortion. It increased the cost. There have been times when we have had to refer people out to another clinic because our physicians fly in and out every week and they're only in clinic for a couple of days a week. And so really your 72-hour waiting period can sometimes be a 5-day or a 7-day. So people have been clearly impacted by that law.
Sure. I used to be the executive director of the Chicago Abortion Fund. And when I was at Black Women for Reproductive Justice, we had an abortion fund there as well. And it the same thing, you tell women, you kind of work out an arrangement with women where you say, okay, we can help you with this amount, you need to raise this amount. And sometimes it takes them a week or two to come up with that amount that they're supposed to raise. And then when they call back, you have to sometimes deliver the news that, well, unfortunately, you've transitioned to a higher cost level. And so now we need to raise more money to try and help you, and we need you to try and raise more money. And so it's really a heartbreaking bind that women often are placed in. Dr. Gillian, do you want to talk a little bit about some of the some of the other political hurdles that you have had to face as a provider of abortion care?
Sure. I also want to say that I think part of why the mandatory waiting period rules are so galling is because it sort of makes the assumption that people who are obtaining abortions had not considered what they were doing before they went ahead and made the phone call. And of course, anyone who's worked in an abortion space knows that people who can become pregnant have been thinking about this decision. That's not to say that everybody is decided by the time they come to the clinic, but they certainly have been thinking about it, and sometimes for weeks, and sometimes it's preoccupying their thoughts all the time.
Absolutely, and it really is second guessing a woman's decision that she's already made.
Yeah. And if it was really about making a decision, it would be something that would be applied to all medical procedures, because all medical procedures inherently have risks. And when I am consenting someone for a more risky procedure, like a hysterectomy, there isn't that sort of mandatory waiting period, even though it's a higher medical risk procedure.
Absolutely, absolutely. I also think that came across in terms of the decision-making process that women undergo. I think it also came across when the provider was saying that I don't have to know why a woman wants an abortion. I don't need to know that. And I remember being in conversation with Dr. Willie Parker, who was also in the film once, and him saying, sometimes he's had patients who are in tears when they come and see him for an abortion. And, he says, I don't have to know the reasons why. I just want to know that this is your decision and you're okay. And you're okay with your decision. And if you can tell me that, then I'm good. I can perform the abortion. And one of the staff people in the film actually said, sometimes people cry when they have the procedure. And I think, again, the film did a really good job of bringing that to life at the beginning when you had the patient who was having her abortion. But again, you saw the level of humanity that from the doctor, from the staff, the nurses, the clinicians, how they were all in the room surrounding her and, encouraging her, and you're doing a great job. And even down to how the doctor told her step by step, this is what I'm going to do. I'm getting ready to do this. You're going to feel this touch. And how the rest of the staff really surrounded her, and just, even if it was to hold her hand or place a hand of comfort on her shoulder. Julie, can you talk a little bit about how that level of care is provided in your clinics, and what you have seen that mean to women who come to your clinic for services?
Absolutely. One of my mantras, I think we talk about it at about every staff meeting, is that we are facilitators. We are not gatekeepers. We are there to help people. Also, Dr. Tiller used to say a lot, and I'm sure you've heard this, that abortion is not a medical matter. Abortion's not a cerebral matter. Abortion is a matter of the heart. And until you know the heart of the woman or the person, you don't know anything about abortion at all. So I think that, having an open door policy that says all who, come into our clinics, and I think you find this to be true at almost all the clinics that provide abortion care, I could safely say, is that, we are there to treat people with dignity, respect, justice, compassion, and that, it's medical care that a person needs right at that time in their lives, so that then all these other pieces in their life can fall into place or come to fruition. So we're there to help people achieve their desires and dreams, and I'm so proud of just the level of compassion that staff members that our clinics have, and I just can't say enough about that.
Julie, can you also talk a little bit about the state of freestanding women's clinics? I think perhaps, a lot of people may not know until, of course, they see this film that over 60% of the abortions are provided in freestanding women's clinics. And I think a lot of folks may not realize that. Can you talk a little bit about that, Julie?
Oh, yes.
About the state of freestanding women's clinics.
Yes. Well, so, abortion has been, over the last several decades, pushed out of mainstream medicine, out of hospital settings, and pushed into freestanding facilities. And, that was a strategic political move by anti-choice operatives. And so by doing that and pushing, abortion care out here on this, island of medicine all by itself, then they could start to pass laws to just chip away, and we see that in trap bills across the country, targeted regulations against abortion providers. And so then hence we find providers that have just been literally regulated out of existence. I can't say off the top of my head how many clinics have closed over the last, 5 years, 10 years, but we've lost a lot of providers because of these prohibitive laws that have been passed by anti-choice legislators in a variety of states. And so what does that mean? That means it affects people in these states that are politically hostile. Legislators are damaging and destroying the lives and harming people who live in their states, who they are supposed to be looking out for and caring for by passing good legislation. And you see people driving for hours. You see people who are unable to access care. It's heartbreaking. It's heartbreaking when you see someone who's very creatively say, been able to travel 4 or 5 hours to your clinic to get care. It's heartbreaking that we don't have more providers around the country who can provide abortion care to people in their home communities.
Sure.
Toni, can I say a little bit about that
Sure.
theme in the film? I think one of the lesser known stories about the abortion rights movement is the role not only of these independent called freestanding feminist clinics in providing abortion care, but the dependency on medical centers and medical schools on these clinics. When I started this project, I was surprised how many interns and residents and fellows went to the feminist clinics in town, and they trained these providers on not only how to do abortions, but also miscarriage management. And I think there's been this distancing and disavowal within the mainstream medical centers on how much they've relied on the freestanding clinics in learning about care, that all of these doctors have to acquire skills in and credentials in. And I think like many oppressed groups or marginalized groups, there's a disavowal of dependency on essential services. And the feminist clinics, I think, have provided essential services for the healthcare system as a whole that hasn't been acknowledged. And in the course of that training, many of these younger doctors and medical students learn kind of feminist principles of care, how you think about a whole person and how people bring their whole lives into a clinical setting. It's not just about a procedure, it's about other aspects of people's lives. So I see these clinics as setting a model for healthcare in going forward that we can learn from.
Dr. Schivone, do you want to talk a little bit about, or would you mind talking a little bit about any challenges you experience with getting training and if some of your training came through feminist health centers.
Yeah, absolutely. So I went through quite a bit of training to end up where I am. So sometimes it gets a little entangled in my mind, but I certainly have provided in a lot of different settings, and, Planned Parenthoods and hospitals and independent feminist clinics. And, I've learned a lot from each person who's taught me and from each patient. Certainly there are major barriers to being taught about abortion and how to do abortions, which is obviously very unfortunate, but also one of the things that was hinted at but not totally made explicit in the film is that it's one of the most common medical procedures that is done in the United States, and one of the most common medical procedures that people have. And so people don't realize that so many of their patients have had abortions, and that it's important that they have some concept of what that's like, even if they're not going to be doing anything related to obstetrics and gynecology in their practice. Definitely, a lot of academic institutions owe a debt of gratitude to independent clinics. I certainly trained at clinics outside of my academic setting, and there are so many things, again, which were hinted at or discussed in the film, making it difficult for people to get that training within their university setting. Sometimes it's legislative issues, as it is, as Julie discussed in the movie about Oklahoma. Sometimes it's that hospital systems and universities just want to avoid any sort of controversy at all costs. And so places that formerly provided services in a hospital setting have been over time giving that up and moving it out into separate clinics. And it is really challenging for some trainees to access that kind of training, and they have to jump through major hoops. And if you're not really motivated to get that training, if it's an opt-out situation and it's so hard to obtain, many people aren't going to do it for practical reasons.
Sure. Jan, another area that I think you all touched upon so very well in the film was the fact that at most of the, if not all of the freestanding women's clinics, they provide the full range of reproductive health services. And I love how you kind of did this reflection or this historical look back and talked about the whole feminist women's health movement and teaching women how to do self-cervical exams. It reminded me of when I lived in Chicago, and for like years didn't understand my menstrual cycle. And it wasn't until I went to Chicago Women's Health Center at the age of 30 and had probably the best gynae exam I've ever had, right? And so, when you hear someone say the best gynae exam, right? But it really was because, and this was pointed out in the film, the whole idea of being able to be cared for by other women at a feminist women's health center. I mean, my gynae exam, even down to the mittens on the stirrups on the table, and the, soft lighting and the soft music and the candles, and then to have the healthcare worker to walk me through how to do a self-cervical exam. And then in that session with helping me to understand how to chart my menstrual cycle was absolutely life-changing. And I think, you highlighted that very well. It was great to see Judith Arcana in the film. I know her and we've had a lot of conversation. But what kind of led you to want to be sure to include that history of the women's health movement?
Well, it's part of my own history. My first career was a nurse, and when I was in graduate school in LA, I worked as a nurse at the Feminist Women's Health Center, and we did self-exams. And so at that time, the abortion rights movement was part of a broader project of kind of reclaiming control and knowledge of our own bodies. I think the anti-abortion movement has really fed on anxiety about women's bodies, anxieties about kind of the messiness of life, but particularly women's bodies, and how many of us didn't know much about our bodies. And so, you know, when you're a documentary filmmaker, you can include what you want. So that part of our history, I think, was important for me to include, because it was also part of my own history in not only abortion rights, but a broader movement around reproductive rights, reproductive justice, and what it means to reclaim control over your body.
Absolutely. Julie, can you talk a little bit about how your clinics kind of work to include that kind of educational piece for women around understanding their body? What kind of education do you all provide?
Well, we provide options counseling if a person would like to come in and talk about their various options if they are pregnant. People can come in and, you know, talk about different contraceptive methods. Before any abortion procedures that we do, we provide consultations where we sit down and talk one-on-one with the person about the procedure, how the procedure is going to go, aftercare, contraception that they might be interested in, and just being a resource and being able to answer any questions. You know, we provide transgender care in our clinics as well, which comes with a lot of education from our practitioners who provide our trans care. So, you know, I feel like we do a pretty good job of working to educate people so that hopefully then they have more resources, or the resources that they need to make informed decisions for themselves.
Sure, thank you. Jan, we have a question from one of the viewers. I want to, and I've got some more questions myself, but I want to be sure to include a question from our viewers. So for the doctors who were arrested in the 70s, were they able to practice medicine afterwards?
Well, there's a complex history around Roe v. Wade, and there's one line of argument in the film that Judith Arcana with the Jane group emphasized, that Roe v. Wade was in part legislation that protected doctors. It did not assure that, and Willie Parker also takes this up, it didn't assure the right of abortion. It did protect doctors from prosecution. Now, before Roe v. Wade, women could get a therapeutic abortion in many places, but they had to go before a panel of doctors and have a tragic story. Often, I'll kill myself or my children if I carry this pregnancy, or I'll go crazy. So that was a big part of the abortion rights movement, was not to have a tragic story or an excuse for an abortion. But there was a period in the 90s where the anti-abortion movement really mobilized for a range of reasons, and a number of doctors were murdered, and clinics were bombed, and providers were attacked as that movement gained hold in the 80s and 90s. I don't know if, Julie, you'd want to say anything more about that legally.
Well, I mean, our flagship clinic in Wichita, I can say, has a definite history with violence, unfortunately. You know, it was bombed in the 80s. Dr. Tiller's first assassination attempt was in 1993. He was ultimately assassinated in 2009 in his church. Since opening the clinic again after his death, our clinic has been vandalized. The Oklahoma City clinic has been vandalized. So this is, you know, this violence is pervasive still in the United States.
Sure. What kind of support would be helpful from reproductive health rights and justice movements, from what kind of support would be helpful for freestanding women's clinics from the movements? Julie?
Well, let's see. I think that, sometimes even within progressive movements, I still feel that abortion, reproductive health, access is marginalized. And I don't know if this is exactly your question, but I would love to be able to get to a point where we really have a firm understanding of the intersectionality, and abortion is part of that we have all these other factors that come into people's lives. And so I don't know what the easy answer is here, but I think maybe being able to have, more conversation, more education, so that we can have those broader areas of understanding and support.
Well, and I think what you're talking about is more people that embracing the RJ framework, which
Yes.
is really grounded in intersectionality and understanding that, if a woman can't get her abortion, it may be due to a number of reasons. Access could be economic access, could be transportation access, could be not being able to get time off from work. All of these issues are intersecting. And so, you're absolutely right. I think the charge is for all of us to really begin to think intersectionally about how these various issues work simultaneously to impede access to safe abortion care in the full range of reproductive health services.
I think it would be great if clinics would, reach out for collaboration with reproductive justice groups. I think that would be really a wonderful thing.
Julie, can you talk a little bit about some of the collaborative opportunities that you've had to work with some of the RJ groups, reproductive justice groups, your clinics have had?
Well, we have worked in coalition mainly with organizations in the states where we have clinics. When it comes to legislative sessions, when it comes to, we do typically in a non-pandemic setting, we do door-to-door canvassing, and where we've done voter ID and education at the doors of people who we've identified to be warmer potentially to hearing the message of for abortion rights. And those are two areas where we have been able to collaborate with organizations in our states where we have clinics.
Sure. Thank you. Jan, this question is for you from one of the viewers. So in general, did you find that there are more clinics in the North than the South?
I don't know about the demographics of clinics. There are freestanding clinics, part of the national, what is it called, Julie? The National Abortion Federation.
Mm-hmm.
And they're all over the place in a way, although struggling to survive, and many have closed down, but they're incredible places of knowledge and insight and toughness. And we have history of many of them in the Northwest, but in I think most states there are these clinics that came out of feminist principles of care. I think one fight that's really important now on the horizon is overturning the Hyde Amendment, which is terrible legislation passed by Representative Hyde in the 70s, shortly after Roe v. Wade, that denies, other than in rare circumstances, federal funding for abortions. Now here in Oregon, the state picks up that cost, but in most states, that funding is not available and directly affects poor women. And Democrats have also signed off on that, as it's been renewed, by the way, year after year. So I think we're in a political climate where it's really important to push political leaders to do what's right and to make this area of healthcare a basic right rather than something just available as it always has been for women of means.
And I'm glad you brought up the Hyde Amendment, and I have to, from being from Illinois, Henry Hyde came from Illinois. The Hyde Amendment, and you're absolutely right, has been one of the biggest barriers to low-income women, women of color, and young women. And women of color, since the Hyde Amendment was put into place, have always been saying we need to have the Hyde Amendment repealed. And unfortunately, it hasn't been just the legislators, but there's been some pushback from our side around whether or not it's the right time to go after the Hyde Amendment. And women of color have, collectively pushed back and said, we can't afford to wait. We have got to stop saying it's not the right time, and we have to make this a priority, which is why we have, the campaign Like All Above All. But also is the reason why we saw abortion funds to grow across the country, trying to meet the financial need of women who don't have the economic resources to obtain a safe abortion. But even the abortion funds can't meet the need. So, Julie, what I'd like to hear from you is I'm sure you have a relationship with the network with some of the abortion funds, but how have you been able to, because oftentimes women just don't have the money. So how have you been able to make care accessible? You can't have this conversation without talking about Dr. Tiller, because Dr. Tiller, was all about trying to make abortion accessible. So how have you been able to incorporate some of that at your clinics?
Yes, well, we have a no turn-away policy, which means that, if you need to access an abortion and you are short on funds, we are going to do what it takes to make sure you have what you need in order to access abortion care at our clinics. We have a funding coordinator who does work to coordinate funding with the funds across the United States. And then we also have our own internal house fund as well. But, it's absolutely, reprehensible that people cannot use their insurance, whether it's state insurance, private insurance, you name it. People should be able to access and use their insurance for this type of healthcare. And I think it's irresponsible of people to say, well, we're okay with abortion, but, as long as the taxpayers don't have to pay for it. Well, absolutely, we as taxpayers and citizens can contribute to healthcare that's provided through the government. And I feel like it's unethical that we do not. So we provide at Trust Women, once again, we have a no turn away policy because like you were saying, people are like patchworking their care together and cobbling this money together. And we just want to be a resource so we can help.
Absolutely. Dr. Schivone, can you talk a little bit about how the coronavirus pandemic has affected doctors traveling to clinics?
Phew, yes. So, I think it's important to remember that however hard it is for us to get to the clinics, it's usually at least 10 times harder for the patients to get there. And we certainly saw that during coronavirus with there being temporary abortion restrictions placed in states, including Oklahoma, some completely banning the ability for people to get an abortion. So we had patients traveling to Oklahoma and to Wichita from other states. And as hard as it is to access an abortion in that area of the country already, it became even more difficult. And patients had to, travel even longer distances, have even more funds, have more money for hotel and food, or, stay in their car. And it was really outrageous, honestly, what patients had to do to have this legally protected care during the time of the coronavirus. But abortion was framed by legislators as an elective procedure when it is something that is very time sensitive, and that was not acknowledged by some of the laws that were put into place temporarily. So it was difficult for clinicians, just as it was for everybody else, to travel. Flights were very limited. Crossing borders means you have to carry some sort of information that says that you're traveling for an essential purpose. And so Julie provided us with a letter that said that we were doing essential travel. But, our patients faced all those hurdles and more.
Absolutely. And the fact of the matter is, abortion care is an essential service. It's an essential health service that I think all of us, at the beginning of this pandemic, when we started to see the restrictions happening across the country, were just flabbergasted at how anti-choice legislators were trying to paint abortion care as a non-essential service. It's just like, what are you talking about? We have about 8 minutes left, but I want to squeeze some more questions in. So this is from another viewer, and any or all of you all can answer this question. So do you think the overturning of Roe v. Wade is dependent on who will be appointed as the next Supreme Court justice? What do you think?
Well, I think that's a loaded question.
Yeah.
Jan, you were leaning in. Did you want to say something?
I think it's obvious to any of us paying attention that the Supreme Court and the Constitution of the Supreme Court is critical, but I think we can become fixated on that in a way that blinds us to the importance of building a movement and recognizing that we have a lot of support on our side. And now we're at a time where healthcare is becoming more prominent, as is public health needs as a basic right. The obscene amounts of money that are made by many hospitals and the inequities in our healthcare system, where you have specialists making very high salaries and people who are involved in basic care and providing the kind of care that abortion providers do are not making the money off our healthcare systems. There's a lot of money made in our healthcare system. So I think we need to be much bolder in our demands and also support child care and the right to bring a child into the world and have that child cared for, as well as the basic right not to carry a child into the world if you do not want to be a mother. So I do think we're at a time where we can be much bolder. And I wanted the film to also bring into focus how much ground we've won, as well as the receding political terrain that we inhabit, that there are many more providers that are pushing back on stigma and fighting for this within the healthcare system. And so I think a broader social movement and grassroots movement that would include the Supreme Court, but would go far beyond it in terms of what we demand, is what I hope for and what I hope the film contributes to.
Absolutely, absolutely. Julie, Dr. Schivone, you all want to take a stab at it, or has Jan said it all?
Well, I would just say that, now that, we had a favorable decision with June Medical Services, but it, there's wiggle room within that decision based on Robert's opinion, the way that was crafted. So I think that at this point, it's, a wait and see, what might get back to the U.S. Supreme Court. Also we have, elections coming up this November. So who's going to be occupying the White House? So I think that some of this is a waiting game. What we can be doing, well, there are a number of things we can be doing in the meantime, but one thing that we can be doing in the meantime is looking at our states at the state level and making sure that we have things really shored up there, and if they're not, working at that level as well as the national level. So those are just a few of my thoughts.
Absolutely. Well, and I think you did a natural lead into perhaps my last question, which was, as we approach this election season, what can people do to support reproductive health rights and justice? Because Jan, I think you referenced perfectly that what the film highlights, it highlights the core principles of the RJ framework: right to have a child, not to have a child, but also the right to the social economic resources one needs to parent the children that they have, not to just survive, but in fact to thrive. But Dr. Schivone, do you want to talk a little bit about, do you want to answer that question about, as we approach this election season, what folks can do to support reproductive health rights and justice, and also perhaps what they can do after the election, no matter what the outcome might be?
Mm-hmm. Yeah, so I think it is, of course, important to know where your legislators stand on the issues and to look into that and be knowledgeable as you go into the voting booth. Certainly there is much more to advocating for reproductive rights and justice than just voting for president. As you mentioned, there are so many different causes that go into reproductive justice and into the ability to people to parent and parent safely and to take care of their children in a way that everyone can thrive. And so issues such as housing, such as healthcare equity and universal healthcare coverage are so important to advocate for as well as keeping in mind the tremendous issues of anti-racism that need to be addressed and that people are maybe thinking more about currently. There's so many different ways to get involved in your community. Honestly, every community has amazing organizations that you may just not know about. And if you start Googling or if you start asking other like-minded people, you'll find people that are doing awesome work. And you can support them in so many different ways. You can give money if you have any. You can do phone calls, you can, do whatever is helpful to those organizations to work towards those causes.
Sure. Thank you. Jan, do you want to answer the question as well?
I also think, I don't know if this falls into the area of what we're not supposed to talk about, but I think.
Well, let's see.
Okay, I'm a big proponent of Medicare for all, and you know, it's interesting in Canada where they've had a different healthcare system. There are religious people who are fixated on this issue and opposing abortion, but they don't get very far. And if you have a basic healthcare system and we fight for these principles, I think there's less grounds for these arch conservatives to go after women of color, minority, or marginalized people around this issue. And so I think there's a lot that's happening now that should encourage us, and that we shouldn't back away from this moment we're living in, where we're looking at what does public health mean? What does it mean to provide care for undocumented workers, as well as all of the other groups, you know, trans people, people who get shunned aside, in all of these debates about healthcare, where I think many in the pro-choice movement have defended a very narrow space to fight for ground, and we should think more boldly and not be afraid of these people coming after us. And that was the spirit behind this film, is to not be afraid. And these providers aren't afraid, and that's why they chose to be part of this film. And I hope people watch the film. It is now available on video on demand. We have a distributor, and I hope that it opens up conversations, like Julie was saying, to be more comfortable talking about abortion and its complexity in the context of people's lives, and what makes it so targeted in such irrational and mean-spirited ways by conservatives.
Thank you. Well, that brings us to the close of our program. I want to thank you, Jan, for this amazing film, this amazing documentary, and just the profound voice that you have given to providers of abortion care about their work and helping to reduce the stigma that's associated, not just with abortion, but also the stigma that's often associated to providers of abortion care, who are not only providing essential services, but really are really caring for humanity in very profound ways. Dr. Schivone, thank you for your work as a provider. I've long admired your work and have followed you and know of you. And so thank you for your just amazing work and the way in which you care for patients and helping to make reproductive health care accessible. And Julie, thank you. You have not only, you're not only carrying forth the work of Dr. Tiller, but you have certainly made a significant contribution to reproductive health rights and justice through the Trust Women Foundation. So, and the care that you provide, that your clinics provide. Thank you very much. I want to thank our audience for participating in this call to action conversation. If you would like to see a recap of the organizations you can support around this topic, visit Day 5 on the rePRO website. Please make plans to support rePRO Film Festival by purchasing film tickets and attending more of the rePRO Film Festival call to action conversations. You can get full information at repromama.film.org. And don't forget, all ticket sales are donated to reproductive justice advocacy organizations. Thank you again to all of our guest speakers, and thank you to those of you who tuned in with us this evening.
Thank you.
Thank you.